Guys, you can. What were you trying to mention? I'm wondering. I'm like, Joshua was not mentioning the right. Okay, lovely people. It's been over 2 weeks that we shot video, and today we are here in the studio shooting one for you people. And I hope you guys are really appreciating what you are doing each and every week, because the week is very, very hectic. So just do what to subscribe, do what to leave a comment in the comment section. Also, don't forget to like the video. And Joshua can attest to the fact that this week has been a hectic one, right?
Yeah, it was very hectic. I went for one shift and I've been down for 2 days.
You went for one shift and you've been down
for 2 days.
then you had a collateral damage because you're supposed to be down for 1 day.
Yeah, I've been down for 2 days.
Yeah, despite those, those problems, those troubles, we are still here shooting for you guys. So today is going to be a very, short moment with you guys. So we are going to start with a scenario. This is what we basically do at the hospital, taking decisions. I used to tell people that, look, at the emergency, it's not who comes, who serve, like first come, first serve, but they don't get it.
Yeah.
It's not like, joining a queue for food.
That's why we do triage.
Exactly. You have to, know who's supposed to go in, who's supposed not to go in, but then they still don't get it. So we are going to give you guys a very good scenario. What really happened. So we are going to have 2 cases and we are going to decide which of them do we think is supposed to, get in or be seen by a doctor before the other. So that's something that will happen in the first section. We are going to complete with, some few games. The first game being the fact that we are going to know what happens that we are studying in French. Okay. So most of the words that we have in the medical settings happen to be French, and it surprise you guys that
sometimes you even forget the English name.
Yeah, exactly.
Yeah, you end up explaining the thing in French.
Yeah. You'll be surprised that most of them, the words are not even the same in English. So there is someone who's going to quiz us on that if we are really up to date when it comes to the English settings, looking at the fact that we are Anglophones. And finally, we are going to, be able to identify some items from the hospital. So you guys know it as well. And surprisingly, some of them we might not know because we don't work literally at every part of the hospital. I work personally at the emergency and Joshua, it's at the pediatrics. So yeah, hopefully they give us something out of these places. If not, we can start. Yeah, hopefully, if not, yeah. So we can start already. Let's get straight into the video, except if Joshua has something to say. Joshua, what do you have?
I have nothing to say. We just get straight to the video.
Yeah, except that
we're having case number 1.
Your microphone needs to be placed well.
Okay, yeah. Case number 1. Case number 1. Abdominal pain in different patients. Situation 1. Patient A, a young adult with severe lower right abdominal pain, nausea,
the classical case, and fever. Patient B is an elderly person with sudden severe abdominal pain and a history of heart disease.
Who is treated as the priority?
Well, this one is a little bit developed.
Yeah. And it's having a lot of elements we can consider.
And one thing people don't actually know is that, we don't just diagnose patients based on, sometimes talking. We have some other tests we have to do.
Yeah, you have to run a lot of tests before
Yeah. And sometimes you can diagnose patients based on talking, you know that.
And then even based on watching the fellow.
Yeah.
Sometimes inspection.
You can even smell and know that person is having a problem.
You guess you.
Yeah, the person is DK. So yeah, it's like that. It happens, but in this case, it's a little bit developed. Now, this is very tricky because we have a young adult. Everybody will be thinking that a young adult has a lot of life
ahead. So we should consider that. But to me personally, I'll go for the older one with heart disease, with a history of heart disease.
Heart disease,
yeah, because severe abdominal pain can also be a heart, what's the name? A cardiac attack. You cannot just you have to rule that out before.
Yeah. Especially when the pain is actually found in the epigastric region.
Yeah.
So in this case, I'll really.
And then now that he's even known to have heart disease with history of heart disease, I think I will have to consider that.
For patient A, it's definitely an appendicitis.
It'll be simple. That one, you don't even need any this thing to know that it's appendicitis.
But, well, we have a young adult. A young adult too can be a lady, so you can also rule out. How do you call it? Ectopic pregnancy. So you cannot just go straight. You need the workup. Yep. So it's fine that I would really want to help, but it depends on how long the pain was.
What if it's ectopic pregnancy?
Yeah, which need to be ruled out. But then in this case, we have fever.
Yeah.
You have fever.
Yeah.
Fever.
Yeah, so that one too.
Yeah, that one too is definitely an appendicitis in this case, definitely. Well, I will be 70% sure. And then
It's
so
90% sure.
it depends on how long the pain was. Because it can lead to complication when
like
it
I
is
said, personally, I'll go for
appendicitis.
the elderly adult with history of heart disease.
All right.
Yeah.
All right. Yeah, I'll also go for the elderly person with the
And
history.
then just do some
and
ECGs.
give some antibiotics to patient A whilst he waits for
and then some, it was in painkillers.
Yeah, some painkillers.
And then to rule out, okay, we're having case number 2. Okay, situation 1. 3 patients arrived from a car accident. Patient A, open leg fracture, severe bleeding. Okay. Patient B, unconscious with suspected head trauma. Okay. Patient C, complaint of chest pain and shortness of breath.
Yeah, that's definitely, I mean,
okay.
Pneumothorax.
Okay. Personally, I will assess all the 3 cases, get some history.
Yeah.
From these patients before I can consider them, because these are all.
Well,
I
would really ignore A for now.
Severe bleeding?
Yeah, severe bleeding.
It can be puncture artery or vein somewhere.
Yeah, severe bleeding can lead to even a shock.
It can lead to ischemia,
to death. Yeah.
And
unconscious.
If you delay
Joshua,
prison charge,
I've now come to the realization is the brain is really an important aspect of our life.
Yep.
You see, the heart can work.
What if the patient C is also having a heart attack?
Yeah, that's why this patient C is definitely having a pneumothorax. That's what is happening.
Yeah.
Yeah, because it's a pneumothorax right there.
And then that needs drainage.
Yeah, it needs to be drained. But then, in my case, I'm definitely not going to, just stand up and start seeing a patient. I will assess all of them and see those who are actually, because we have scores. That's why at the emergency there are scores that you really have to consider.
To rule out
to see if someone is actually having a severe problem or not. Someone needs to be admitted or not. So in this case, I'll assess all of them based on the course. The scores we have. For instance, unconscious with suspected head trauma.
Master score.
Just be just master 1, and I can keep for now.
Yeah.
And then we have the complaint of chest, could be just a minimum. Pneumothorax that I can keep for now. And then the severe bleeding is what will really catch my attention, huh? Aside that, because
you have to do, yes.
Because in this case, I just think I'll go for the open leg fracture based on my assessment. But it's very difficult to make a decision here. I'll just have to assess
with patient A, you can just do a tourniquet and then forget that one.
Yeah,
to stop the bleeding.
They stop the bleeding, yeah. Hemostasis. And then,
Yeah, just do some radio for patients.
How quick you can do your search?
So if I'm the only one, I'll send the nurses. I'll send them around. I'll send patient C, A. I'll try to do a tourniquet on that one for A, and then I'll send patient B to go and do
CT scan.
Patient C. To go and do radio.
Yeah, a chest X-ray.
And then patient B, depending on I'll just do a fast calculation.
Yeah,
master score.
Because it's unconscious. So
exactly.
It's going
and
for
then
a HCT.
HCT. I would send out for HCT.
Anyways, that was so quick. You should assess them also based on, investigation.
Yeah, but that one, you are the only one. You are the only doctor
at the ED.
So
yeah,
you have to consider all this. And you have to attend to all of them.
Yeah. So I think
if you leave patient A, it's likely to. If you delay the prison charge, it's likely to amputate in leg. Yeah, you lose in leg. Patient B2, you can get hematoma. Hematosudural or extradural. Patient C, that one there, say it can be pneumothorax.
Okay, in this case, they are interesting, but then, that's what I will basically do. I have to assess them and then make a decision. So I think our case number 3 is what you sent to us early, right? So we have 2 patients, man with chest pain and then a child with a broken arm. So in this case, it's going to be a tricky one because we don't have a lot of things about these people. We don't know their medical history and stuff.
Yeah. So, but to me, I'll assess both cases, and then because a man with chest pain can be heart attack.
It can also be just a pneumopathy.
Yeah. So depending on the fellow's history, consider let's take that patient was in our second case, patient B. Depending on the fellow history with history of heart disease. So you have to consider I will consider A before A wasn't in patient 1, the man with chest pain. If they feel it's having,
that
just
means,
depending on the antecedent, the history, the patient's history, and then the age.
yeah.
I'll consider A before the broken arm guy.
That's why you can't just make a decision based on knowing, the symptomatology.
Yeah, you have to get more information.
You have to get the information from the patient. That's why for us it's very, very important. You guys hide a lot from us as well. Yeah, a lot. Yeah. A lot of
When was
stuff.
the last time you have your messes? You'll be doing as if...
Yeah, it's really important. So we cannot just stand up and then make decision based on what you are presenting. Your chief complaint. So we have to do a lot of interrogations. That's why doctors can sometimes be, investigators.
And that's why we do triage before we send the patients in.
Yeah. So in this case, we cannot just make a decision, but we assess our patients and then after that, choose one of them to treat before the other. So that's how I'll go about it.
Yeah.
And that's the reason why I can make a choice just at the point. So yeah. Personally, I'm excited for this one. I will not lie. I'm really, really excited.
Because you think you are smart or what?
Yeah.
I'm smarter than you.
Yeah.
Okay, let's see.
Yeah, let's see, James.
Let's see about that.
Let's see.
Okay. Prescription.
It's prescription.
Yeah, one. Yeah, prescription.
You are using a trick. You are laughing so that it will.
No.
Fine, that's one.
I will do everything to win. Because I think I'm smarter than you.
Okay,
so let's see. Okay. Vomit small.
Fainting.
No.
Fainting.
I thought this was the part we have to read.
You are giving an excuse. I lost. I just
Okay, let's go.
Humility.
Okay, I'm humble.
Yeah. Okay.
Shivering.
So
shivering.
Shivering.
I heard it from you.
Okay.
Oh.
Yeah, shout.
No. I'm not
My
going.
brother, you have to shout.
No, we can't. We don't have to shout.
Okay.
You're shivering.
Okay, shivering.
So we can choose to give all of you.
Yeah, because I deserve it.
You see, wait. Contusion.
Another word. Clean one.
Clean one. It is contusion.
English.
Contusion.
Contusion. No.
No. Yeah, I know contusion, but I think it's contusion.
Yeah, it's the same thing in English.
There's another word. If you don't know.
There's another word. We are not playing this. We are not dictionary.
We are not doing synonyms.
Okay. They'll put it in the comment section next.
Yeah, guys, put it in the comment. We think it's contusion.
Yeah.
Where that modifies the point. Wait, my phone went off. What?
What's the name? Capsule.
I wanted to say comprimé. What English French can do.
Cardiac
failure. Right?
Cardiac insufficiency.
What is cardiac insufficiency? Heart failure.
Cardiac insufficiency. Is
Heart
that
failure.
correct?
Right, so this
Yeah. What is cardiac insufficiency? It's heart failure.
Okay, heart failure.
Wow. You know. Maybe this one I cannot say it, but I'm reading it.
Sclerosis and plaque.
Plaque or sclerosis?
Sclerosis.
there's a word.
Plaque sclerosis. Sclerosis plaque.
No. Sclerosis.
Yeah, there's a word. Just not one word. Like
They give you two words. You want to say what?
Multiple sclerosis.
that's weird.
Mad.
Where did you learn that thing from? I've never seen it before.
I've watched what's the name?
But
A to Z medicine.
Plaque is not
A to Z.
but plaque is not multiple. How did you know it's multiple sclerosis?
That's why I said I watch A to Z videos.
Right.
Next.
So it's the same point.
Plural
effusion.
effusion.
Who said
Who
it
said it
first?
first? We always said it. Plural effusion.
You will detect it.
Okay, we will do
Plural
replay.
effusion.
I said it first.
No.
You
We all
just said
mentioned plural.
plural. And I said
effusion.
effusion.
Yeah. Plural
Okay.
effusion.
Share the point. Stuff.
Malaria.
Relax. Yesterday I mentioned it. We had a patient who came and I was like, with the malaria
Yeah.
patient.
Yeah. That was yesterday.
Malaria patient. I don't know this one.
Varicella.
Right, what? Varicella. That sounds like my sister's name. Varicella.
That was also in the comment section.
Yeah.
Okay.
Varicella in English. All right. Okay. What do we have? I think we are all having the same point, so we have to dive in. Rubies.
Rubes.
Rabies.
It's not rubies. It's
Be
rabies.
rabies.
You said rub.
I said Is that rabies?
You are not giving a
It's
point.
rabies.
Rabies.
The dog disease, right?
Dog bite.
Dog bite something.
Mm-hmm.
Oh, I don't know.
Coqueluche.
This one looks like vaccinations.
No. Coqueluche.
What is it?
No, I've forgotten. I'll not lie.
You don't know.
I know I've forgotten.
So you don't know at this point.
Okay,
you
at
don't
this
know.
point I don't know.
Yeah, you have to be humble.
Mention.
In the comment section.
Okay.
Do we even have this word in English at all? How would you? Anterior
Anterior
ligament.
ligament. Tear. It was a ligament tear.
Anterior crucial ligament. But this
Ah,
so crucial ligament.
Hey,
Crucial. Yeah.
cruciate ligament.
Yeah. Okay.
Cruciated ligament. Yeah.
Cruciated
Cruciated
ligament.
ligament.
So that's all.
Great. So I know who won this, and
Nice of me.
I
It's
won.
ready to make.
Yeah, I won.
How?
Yeah, I won.
What's some of this? We have to share it. Some of the points here.
Yeah, we shared. You do the video, you will see who won. Okay, guys. After doing the first round and I got Joshua, I am trying to be generous.
It doesn't mean you are smarter than me.
Yeah, it doesn't mean though. That's why I'm giving you opportunity again.
To do what?
Yeah,
To rattacher.
to rattacher. Exactly.
Okay, let's
so
see.
what we are going to do is that this round, so I'm going to add it to the previous round.
Okay.
Even though I'm leading,
Hey,
if you-
relax.
you are going to
How
add
sure
up.
are you?
You do. I know. I calculated everything. So what will happen? I'll be editing the video, so I know why I said I'm leading. Even
Okay.
if I'm not leading, I'll add a point
Let's
from
go.
somewhere. Now I'm going to make that point to shift into the second round. That means that if you're able to get a point, it nullifies my point from the previous round. You get it?
Okay, let's see how it
So I'm
goes.
just putting it.
Okay, that one too. We have to use. Okay.
Yeah.
Let's see.
Pictures will be sent. You are supposed to mention the picture, mind you, in English.
It's in English or
Yeah.
it's in French.
In English.
Mention it in English.
In English.
Oh.
And then again, let's
Me, I
say,
prefer
relax.
French to English.
I don't have time to do translation. And with
Okay.
that, if you like, if you want to show the people that you know what it is, you can tell us what it's used for. But if you don't know it, at least you get your point from knowing what it is.
Let's go.
So relax. This will have to.
Stethoscope.
No,
Hey,
I have to download.
speak.
I had to download. So
Speak, no?
wait, you know what it is, but you have
Yeah.
to mention it to her. It's not stethoscope.
That's what I said. Speak no. Speak no.
It's sphygmomanometer.
That's what I mentioned. Speak no manometer.
I'm hearing a lot of manometer. It's sphygmomanometer.
I had it.
He had it.
I had it first.
But I heard manometer.
No. Oh, it's used to measure it was a
But
blood
now we
pressure.
don't use this thing most of the time because we have
Yeah, this is
the
the
digital
Akik.
one.
Yeah.
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 But it takes time for me to download my pictures, so you guys,
That's not an
it's
excuse.
kind of a little cheat.
Let's go.
I'm using the same one for though. Yeah, let's go.
You
Gani,
can
what were you trying to mention? I'm wondering. I'm like, Joshua was not mentioning the right thing. He just saw me mentioning Gani. What was it's a
Okay.
gardening. It's used to transport patients.
Patients, yeah.
We roll it all the time. Sometimes I push it myself.
or stretcher base.
Yeah, stretcher beds. But well, we know it as a gun. Bring the gun in.
Mm-hmm.
Okay, this is
Sugar
sugar meter. It's not sugar
dextro. Dextro.
Yeah,
Dextro.
yeah. English they have a word for it, but it's also like dextro, but it's not dextro. It's dextro something, but I just don't know. But it's used to measure the bedside blood sugar.
Sugar. Yeah.
So the
So
BGM.
it's dextro. I had it.
We can use that.
Yeah.
yeah. We
You can call it
Glucometer. Glucometer.
glucometer.
Yeah. Metre is in English, French.
Yeah,
Okay,
glucometer.
glucometer.
So this,
Glucometer.
so are we? Am I giving you the point?
Yeah, you have to give it to Dextro.
Okay, dextro.
You have to give it to me.
Sap. What is sap? Sap is like what's sap? It's not sap. It's,
Sap, okay.
I think it is-
Electric string.
We all know it's electric string pusher.
But that's why I had it first.
What? No, but we all know it's electric. Whatever you are saying, the most important thing.
Electric string pusher.
This is the name I'm expecting.
Yeah, so I had it first. Okay, string infusion pump. Okay, we will call it SAP.
So no one had it. So it's
So-
a string infusion pump. Wow. Probably that's why I think in French it has to do String something pump. That's why it's called
Sap.
sap. You have to look for the meaning of sap. So all this right, that's
A la sap.
Yes, the meaning of
Sap. Oh, what I know is I know how to manipulate it.
So syringe, adapté, whatever it is. Well, could I search for it? Well, let me search for it before you move. Sap. What sap is? Sap.
So I teach you something now. You take come up here. See? This is not fair. This is not fair. It's not fair.
Pousser médicament.
Okay, let's continue.
Okay.
This one will take time.
Wait. I'm not in my destiny. Pousser seringue électrique. It is called seringue auto-poussée.
Yeah. Sap. Yeah. String auto-poussé.
Interesting.
Ready?
Yeah.
Oh, man.
Otoscope. I had it first.
Yeah, you had it first.
We agree on that.
You see how I give it simple because I know that here I'm not. Yeah. Otoscope. Okay.
Is that all?
You didn't tell us what it's used for.
Yeah.
Must we?
You should educate us.
It's used in examining the ear for allergies, the ear infection.
Yeah, allergies, infection. For infection. Ear
For infection.
But not ear infections. Ear inflammation.
Inflammations.
Because infection can lead to inflammation.
Inflammations, yeah. Just look for otitis.
Is that how they will say it?
English is not otitis. Otit. Okay, otit.
All right. Stethoscope. How do you call that? You call that thermometer? This one. This is stethoscope.
This is serious.
Oh, mad.
This is serious.
No.
Okay. This one I'll give it to you. No. It's my mind. It's my mind.
No, you can't. No,
It's my mouth.
Me, I didn't even download, but I was able to tell if it was a stethoscope.
Okay, then you've seen it before.
I've not seen. No, it's obvious. It's bled. It's bled. Oh, come on.
Okay, let's go and continue.
You are trying to say I
it's not
saw
my
an
fault.
apple. How do you call this thermometer? See, there's a bucket. There's a bucket in Ghana we call it Veronica. Yeah, it's called Veronica.
See? Franchement, I know this one.
Me too. Well, who use it?
Frankly,
who
I
are
know
the
this
people
one.
who use this thing?
Yes, if you are vomiting, if you are doing
A kick bucket. This is
kick bucket.
Kick bucket. So, well, honestly, what is funny is that where they had the idea of the guy kicked the bucket.
I think.
Yeah, because when the
was this one person that I like?
Kick
Frankly,
bucket.
I don't know it.
Well, I think this is where they put all the rubbish. Yeah, I think it's meant.
OR,
Yeah, the OR. But I've never seen. We use plastic ones.
Yep.
All right.
One recently has
Niroshi.
Wow.
Okay, see, you might feel if now. Nothing
Well,
sport.
that's
Let's
a kick
continue.
bucket, guys. Kick bucket.
Kick bucket.
They kicked the bucket.
Eh.
Oh, what is this?
Oh, that don't see it. Yeah, I don't know.
This one's for covering the head. It's a bonnet.
Like,
Medical bonnet.
bonnet. Is this one you check a primo?
I've never seen before. I've never seen this thing before. Yeah.
And test and so must we know everything?
Yeah.
Okay.
You see,
Okay.
when they put the ice on there, broken, joint or inflamed, joint.
Okay.
Yeah.
Okay.
When you are also bleeding through the nose, you can actually
Yeah.
use the ice bag to coagulate. The blood.
But we do okay, make me not talk about that one.
But this thing you can really buy. Pure water and then ice, kick it and use.
Okay.
Thermometer.
Thermometer.
You nearly said
Thermometer.
temperature.
I said thermometer.
What's thermometer? English.
Yeah.
Thermometer.
So is it that we share the point or we nullify this?
Okay, nullify. Even if you share it's the same thing, but nullify. I'm leading though.
How should
I know, Joshua.
it's echography.
This is no ecography. Ultrasound.
Ultrasound echography.
But ultrasound. What is ultrasound ecography? It's ultrasound.
It's ecography.
Hey.
This one I don't agree. It's ecography.
What is he checking? Is she checking at all on the ultrasound? All right.
You cannot take French. Hey,
This is
wait,
a-
relax.
A breathing mask.
Max.
What?
What
A breathing mask.
Is this a mask?
It's a mask, alright, but mention the right thing.
A breathing mask. It's not a breathing oxygen mask.
Oxygen mask.
What? When I mention it, don't mention it as if you need.
No, I wanted to say it was a high concentration oxygen mask. That's what I wanted to say.
Who cares about the concentration?
It's oxygen mask. I had that.
Okay, I'll give it to you. Nothing spoiled. But I wanted to say high
What
concentration
is high?
oxygen mask.
No, it is oxygen mask.
Okay.
Okay.
Uh,
Laryngoscopy. Tablet.
You ended before here.
Yeah, I even ended before it even started.
I'll show you.
Yeah, can't you hear when I
I
speak?
gave the
I
gesticulations.
heard it here though.
Huh? Yeah, that's
But
why.
I started with the larynx.
There's no cookie.
Scopy. I had it.
Scopy.
Yeah, I had it.
Scopy.
But I said scopy.
I said laryngoscopy. You have to
Then
go
I
back.
said scopy.
No cookie.
Laryngoscope.
Good.
So I had it.
Yeah,
I
laryngo.
agree.
Totally. That's all.
That's all.
Not really.
Okay.
We are good to go. Few ones.
Hey.
Ready to go.
All right. Quick.
Scalpel.
Scalpel. It's not scalpel. It's scalpel.
But that's what you're just looking for.
Okay.
Yeah, I'm right.
But it's
You're
not
just looking for.
scalpel. You wanted to say it in French.
Oh. I said I prefer French to English.
Charge.
No. What is that?
Charge is what is used to, you know. How do you call it? I've seen it in the ICU several times. Mad.
What is it used for?
It's used to, you know, sometimes,
Wait,
we have some
forget
kind of heart attacks, right? You have two forms of heart attacks. You have the ones, oh, you're not asking for that. You just want the name.
I won't mention the name.
All right. I only know the only thing different.
That's what I look for.
Yeah,
Different
it's the same,
letters, so
but you didn't get it.
yeah, I was
That's
just
okay.
looking for it.
But well, this is actually used to convert the heart electric charges or even charge the heart. Yeah. In the case where you have a heart attack and then it's actually a chargeable, I don't know how to
It's
say.
okay. Let's move on.
Yeah, a
You don't
shockable
even
heart,
know.
you can shock it with it. Yeah.
It's shockable rhythms. This one be
Shockable- wait,
yeah.
you are
It was
confusing me.
oximeter.
Oximeter. I had it.
I'm had
it.
Oh no. This one I will
I
not
had
agree.
it. Why would you agree? Because
Because
you're
I just
supposed
helped
to
you
mention it.
mention it in English.
It
Me,
is
I'm mentioning it in
oximeter.
French.
Look at it. We read more than one thing on this.
Posimeter. Heart rate meter.
No. This is oximeter.
Pulse of
Oximeter.
So we had it wrong.
breath.
Pulse. It's pulse
okay.
oximeter.
Oh yeah, oximeter.
So we had it wrong.
Yeah,
So you just don't want
We
to give
had
it to
it
me.
wrong,
You
it's
just want to
nullified.
give it to me.
And then maybe 0.5. But there's nothing like 0.5. So yeah.
last
You just want to give it to me. That's
Please.
last one.
Mm-hmm.
why.
Lipstick.
I was going to say bandlet.
What is it?
Lipstick.
Dipstick.
Mad. But you have to be precise. We have a lot
Yeah.
of dipsticks.
This is
Urinary
dipstick.
dipsticks.
Urinary dipstick. Yeah, it doesn't change the fact that I know it. First, I wanted to say it in
You know,
French.
but you don't know how to mention it in English.
I wanted to say it in French.
Okay, I think we all had the same point, so we
So,
need a tiebreaker.
what is your? I beat you.
You beat me 0.1 over here, added to the previous. Okay, 0-0 is the same thing.
So this last one, I'm not taking the same question.
Why won't you take it?
We are done. Wait.
See?
So conclude.
Why
So
won't you take it?
Conclude.
Why won't you take it?
We'll take cover that at the back.
you won't
Okay.
take it. It's called. So I want to conclude. If I'm concluding, that means I'm winning. That's why I want to know.
No, you are not really.
Okay.
Okay, so that means that you are accepting the wrong thing.
It is not wrong.
It's not wrong.
So why are you not accepting it?
Because I wanted him to say what I wrote.
Yeah, that's.
Oh,
what
so
you
it's
wanted.
wrong.
It's not wrong. It's
Well,
the same
despite the
thing.
fact that it's wrong, Joshua. Despite the fact is everybody knows this is wrong. They want
It's
to.
not
you know,
wrong.
because I'm the only
That's the
one
right
here.
thing.
You happen to be three. So when two is voting against you, when two is voting against you, you have no choice but to just accept. And so we've come to the end of the video, and you guys should judge for yourself who is smarter. I'm obviously the smartest one. If not, you are going
Okay, I'll
to
not take that.
do a lot more than this to tell you guys who is the smartest, because this is just the beginning of it all. And please do well to subscribe to the channel if you really enjoy what we normally do on weekly basis, despite the fact that you're always tired during the week. And also don't forget to leave in the comment section who you found.
I went
really
for one
hilarious.
shift and then I've been down for 2 days.
That's collateral damage. Yeah. But so far so good. I've had some couple of golden weekends, which I'm really
I haven't had one
grateful
yet.
for. And please do what to also like the video, because it's really important to keep the video going so that people know about what's really happening in our life, as well as learning from us when it comes to medical situations.
Go diametrical to the point. Okay, see you guys next week.
That is the diametrical.
Same time.
That is the diametrical to the point.
Yeah.
All right, see you guys later.